also associated with streptococcal infection, which creates OCD, tics, aggression, which what I was told was just autism. When we treated the pandas with IVIG, $8,000 a pop per kid per month out of pocket. Those behaviors went away. My kids are getting slightly better because we're able to afford care. Fighting with the insurance company, and you know, this has been going on so long. My kids were born in 2006 and 2004. My children did not need to develop autism. Please take that back.
If I could, my comments, I talked about this antioxidant glutathione that's so very commonly low in kids with autism, but it's not a common measurement. You can't go get your blood drawn in a hospital or a doctor's office and have that measured. It should be measured. It should be a test that can be done routinely and would be covered, you know, by Medicare and things like that as well. So in any case, there are some things that can be done to bring care and affordable care into the mainstream medicine here.
I also wanted to mention something to that because you may have dealt with autistic families in your offices, and I know sometimes we have a reputation for being very demanding. And I think you need to understand what these families are really going through. You've heard 2 stories here today, and we're desperate. So, you know, we've been compared to the AIDS activists. So please understand the desperation and frustration we're feeling, and that we're coming to you asking for help.
I think there was one more question.
Yeah, I just wanted to ask, based on what you found on some of the environmental risks, specifically the proximity to freeways and pollution, if you found that there's higher rates of autism in more, I guess, densely populated areas as opposed to not?
I don't think a density study has been done, but it's a little bit confounded when you try to look at population density, because it's also higher density of practitioners who do the diagnosis. So that would be a harder thing to look at, but it's definitely worth looking.
Just I note that we're somewhat running out of time here, and I want to point out in the recognition that we are approaching Earth Day, we've decided to make this a paperless meeting. What we did have was some remnant handouts and such that we wanted to make sure that those were available to you, but the actual presentations and other information that you're going to want to have is going to be at our website. You'll be able to get that there. If you want to go ahead and print it out, that's at your discretion, but we figured putting that out there with all the paper and everything else was not necessarily in the best interest. So one last comment, and that, you know, we are trying to address what's going on in the environment, the whole chemical soup that's out there, the 80,000 plus chemicals that are currently untested and basically unregulated, and the lack of knowledge that we have there. We do need to have answers to that, how they interact, what happens. There are families of chemicals, neurological toxins. We know that we can start looking at these families of chemicals and making great headway. Mercury being one that we know that is a hugely impacting chemical. Lead and other heavy metals have similar properties. We should be looking at these things in a way that's going to give us greater efficiency in the research that's being done, so that we're not spinning our wheels and pouring money into different areas and duplicating research. Thank you.
Can I ask a question real quick? Sure. When we're talking about environmental issues, and we brought up one of the most important issues that Congress has looked at but has not yet been resolved, and that is the issue of vaccine injury. And I look at it from a perspective of just like what I would call a dirty dozen of issues that we could reduce exposures to, including medical injury, and that would help in preventing the increased incidence of autism, and help also looking at addressing the treatments and studying the treatments to show benefit, because I think Lynn mentioned earlier that by treating children who have a medical injury and other environmental factors that have developed into autism, you actually get some or total recovery, and that's an important factor that hasn't gotten a lot of discussion. And I think that, you know, stay in touch with SafeMinds on these issues and let them be a resource to you, because that is important. But Linda, can you talk about some of the, like, what the top 10 or 12 issues would be on environmental issues? Like pesticides, mercury?
Okay.
Yeah, exactly. I have my perspective in terms of mercury being top on the list because my son received very high exposures to mercury both prenatally and postnatally because my blood type was Rh negative. I received products that were preserved with aerosol mercury-based preservative, and it was far above what was allowed by EPA. It was injected at 14 weeks and 28 weeks, and then my son afterwards received 125 times his allowable exposure to mercury from his infant vaccines. I had a lock of his baby hair at 20 months of age tested, and EPA's action level for mercury in the hair is 1 part per million, and my son's levels were 4.8. So for me personally, mercury is one of the things that's on the top of the list. Mercury is not just in vaccines. That was a big exposure that we were having. It is still, though, in the flu vaccines that's given to pregnant women, and it's in the flu vaccines given to infants, but there's also an increase in mercury in the environmental area. There's mercury in over-the-counter products. In bleaching creams have very high levels of mercury. There's somebody in the back who's also... corn syrup also uses a process, a chloralkali process that releases mercury, and everybody knows how much we've relied on corn syrup. So I think metals have a pattern of injury that we see that's identical to what we see in children with autism in terms of hitting the immune system, the neurological system, the metabolic system, the GI system. So to me, looking at metals is a big one. I think we need to focus and be strategic in looking at those environmental factors, I think Irva mentioned, that have increased since basically they determined that about 1988 was really the change year. This is based on a researcher from EPA where the rates of autism started to dramatically increase. So we can drill in and see what was it that started increasing. You know, some of the things in our environment, the pollution levels have actually declined from what they were in the 60s and 70s, but there are new chemicals and things that have increased. And I think maybe Dick or Irva would also have their top 10 dirty list for where we should start.
I actually had a list on the slides, I have to say, so if you want to go to the website, you could probably start there. Irva?
Yeah, again, I think I think metals are really important because they are neurotoxins. Pesticides are designed to attack the central nervous system of, you know, insects or rodents or what have you, other species, but that's how they operate, that's how they, you know, how they kill those other species. So pesticides, you know, are again designed to do damage to this very system that we're talking about and other systems. I think that the metabolic conditions are interesting because, you know, this obesity finding, and Dick had on his slide high fructose corn syrup. There's actually another researcher at UC Davis who has shown a very strong association between the dysregulation that happens in terms of how fats are metabolized in the body in obesity and high fructose corn syrup. And in fact, you know, the obesity epidemic kind of dates pretty closely to when we started replacing other sugars with high fructose corn syrup in virtually, you know, just throughout our food supplies. So one possibility is that dysregulation is then altering how the brain develops, and that the obesity and metabolic conditions are a pathway that then leads to the child neurodevelopmental disorders, or there may be other pathways but with direct effects through high fructose corn syrup and other similar endocrine disrupting chemicals. So that's a big area. I'm really interested also in the fetal ultrasound story. Putting heat very close to the brains of these young fetuses may not be a very good idea, and there are some experimental studies that suggest that you can really mess up the way the brain gets organized and how it actually structurally gets put together through ultrasounds, possibly too many of them are at the wrong time points. And I think the medications need to be looked at as well. Medications affect inflammation.